Welcome to the 411 questions. Let's get into this. Question 1. What's the cause for dark bags under the eyes? I eat organic food, sleep well, feel healthy. Otherwise, I can't figure it out. Thoughts? Has to do with mineral absorption. And think of this. When I present you with the greatest plate of healthy proteins, fats, and carbohydrates, but if you have any kind of stressor in there, particularly low stomach acid or low, that's going to cause poor mineral absorption. So sleeping great's fine, but we got to go back to the three basic: physical, chemical, emotional stress. So we've got to look at the entire structure. It's like the testing that we do. We do static and stress x-rays. And these are people who come in and fill out on the form all their symptoms, and they put wellness. They're fine. Okay, so when we look at that, 90% of the nerves coming off the spine, there's no pain fibers. So if you ask somebody how they feel, that's really erroneous information. So look at static and stress, digital x-rays of the entire structure, particularly cervical, thoracic, lumbar, and pelvis. Okay, and that's the whole structure, because the automatic nervous system is responsible for resting, digesting, repairing, regeneration, everything is located in the neck and the pelvis, so in the upper neck. So you've got to look at the structure, and then we do a surface electromyography to see what the muscle activity along the spine is. And then we do a full body thermography, because there may be an underlying chemical stressor, such as dental cavitations, mercury, something that could be an underlying issue. There could be underlying pelvis issue. So if you look at your foot, if your big toe is leaning towards the other one, that means that the pelvis is off. And that pelvis houses half, because the nerves that supply that foot come out of the junction of the lumbar and pelvic, or sacrolumbar area. And that's going to be compromising that area. So look at the physical structures for sure. Good diet, good sleep, that's going to be ideal. But make sure when you say that you sleep good, that you're sleeping through the night, you're not getting up at night to pee, and you're not rolling over at night because you're uncomfortable. So look at our sleep restriction, because a lot of people say, no, doc, I sleep great. I only get up like 1 or 2 times, but I go right back to sleep. So double check the sleep area. Look at bowel function. If you have 2 to 3 healthy bowel movements a day, again, that's ideal. And a lot of people will say, nope, I feel great. I poop every day once. And that typically, unless you're fasting, is going to be a stress state. And then look at the emotional component. So in physical, chemical, emotional stress is equally as important as what you eat, equally as important as the physical stressors. So if you're actively every day doing the neurolinguistic programming, visualization, meditation, prayer, all of those things are fantastic. But if you're watching a scary movie and you don't like scary movies, okay, your body is going to be acting like you've had a physical trauma. So address the physical, chemical, emotional stress, and then you're going to figure out why there's going to be poor mineral absorption. And also look at the live blood cell analysis, because when you have, and you're going to see a secondary finding there, where the red blood cells should be separate and bouncing off because they have an electronegative charge. If they start to overlap or be stacked, then we know that there is some kind of stressor. So physical, chemical, emotional stress, and you'll see the body regenerate fairly quickly. Question 2, in regard to hanging your leg from the hip joint, could a person hang from a bar with their feet off the ground? Is it the same thing? People can do it. And this is kind of cool. Inversion therapy. At the very first clinic that I was donating my time, I was still a student, and this guy had an inversion therapy, because when you turn someone upside down, beautiful. You have the reverse force loading. It can hydrate the disc. It's fantastic. So for a regular human being, it's fantastic. And what I've told people for years, for an American, it's dangerous, because if you're taking medications, if you have a toxic diet, you're increasing the pressure in the skull. Which for a human being, it's fantastic. But if your blood's toxic, if you're in a chronic state of stress, this can negatively affect the brain function. I had this one guy, and here I am. I'm in the first 2 years of the chiropractic education, and I'm just setting patients up. And this guy comes up after an inversion and goes, "Doc, I feel a little odd." And I said, "Wait a second. You said you weren't taking any medications at all." "No, I don't take any medications, just the aspirin a day." And it was just like, okay, you're taking something that weakens blood vessels, and I just tipped you upside down and increased the pressure in your skull. So inversion for normal, healthy humans is a great benefit. But now it cannot be the same thing because you need to get movement. You need to have that distractive force and then movement. So if you're going to hang by your feet, you would have to bend your torso forward and bend it backwards. And we want to do alternative swinging. Okay. So you're going to be swinging that leg back and forth. And that, when you're looking at the hip is a round socket. So when you swing your leg forward, you get a force loading. Swing your leg backwards, you get a force loading. So you need that movement along with the distractive force. So a distractive force hanging upside down is going to be great, but we need the distraction with the movement. Question 3. My husband has been trying a neuropathy treatment called Neurogenx that uses high-frequency electrical stimulation. Is this good in your opinion? Well, I taught physiotherapy lab, okay, and we used every kind of electronic device that you could imagine. Okay, I use a PEMF machine, okay, on almost every patient to stimulate an electronegative field to do it. And I looked up Neurogenx, and it's a modality, okay, and any modality is going to alter the structures in that area, and it can help with symptoms, can help with the repair process. It can help with muscle stimulation. It can help with vasodilation or opening up the blood vessels. It can help with deadening the nerve sensation. And this is why they're based on different frequencies. 30 cycles a second can vasodilate. 10 cycles can loosen up ligaments. 60 cycles a second can affect the muscles. 100 can affect the nerves. And it's okay, kind of. Okay, but you've got to address the underlying problem because neuropathy is not, let's say it in English, pinched nerve. So, this is really common in the psychotic world that we have today, where someone will have burning, electrical, sharp shooting pain going down their leg or down their arm or something, and they're not looking at the source. So if you have neuropathy in the legs, feet, look at the lumbar, pelvis, and that's going to be static and stress x-rays. The lumbar can be affected by a lateral thoracic deviation as well. And so you have to look at the entire structure. If somebody has neuropathy in their feet, neuropathy in their, you look at the main structure. So as long as you're addressing the underlying cause, neuropathy in the upper extremities, you got to look at the neck. But you really have to look at the entire structure, because the loss of curve, forward head carriage, reverse in the neck can have neuropathy throughout the entire system. So it's okay. It's not a be-all, end-all. And if you're not addressing the underlying cause of physical, chemical, and emotional stress, then you're going to feel good, but it's not going to be addressing the underlying cause. So address the physical, chemical, emotional stress. And that's going to be static and stress x-rays. It's going to be live blood cell analysis, nerve scans, and then do post x-rays, post nerve scans to show that you actually fixed the problem. And then you're addressing the cause of the neuropathy.